Hello viewers, you're once again welcome to Anatomy Simplified 365. In today's video we're going to learn about the strongest, the longest and the heaviest bone in the human body that happens to be the femur. And this is how the femur appears. These are the parts of the femur that we're going to look at into details and see how they appear on the bone. So let's briefly look at other illustrations so that we can see more of their appearance. This is the proximal part of the femur, and this is how the structures appear. We have the head of the femur, we have the greater trochanter, we have the lesser trochanter, we have the neck of the femur, and then we have the intertrochanteric crest that runs from the greater trochanter to the lesser trochanter. Remember, this is the medial view of proximal end of the femur. And then we have the fovea capitis. On the head of the femur, it's a point of attachment for the ligamentum teres. And then these are also similar illustrations that show us the head of femur, right there, the neck, the greater trochanter, intertrochanteric line, and the lesser trochanter. Remember, the anterior view shows the intertrochanteric line, and then the posterior view shows for us the intertrochanteric crest. Similarly, here we have lesser trochanter, we have the gluteal tuberosity, the pectineal line that is right here. Then we have the trochanteric fossa that is inside there, and quadritubercle that is just right here. And then these other parts, how they appear from different views. This is how they are. Looking at into details, here we are. Here we have the femur. This is the anterior aspect of the femur. This is the anterior aspect of the left femur. We have the head of the femur that is right here. We have the neck of the femur right here. We have the greater trochanter right there. We have the lesser trochanter right here. Then we have the intertrochanteric line that is right here. And then we have the shaft of the femur running like this, up to down. Then we have the lateral epicondyle that is right here, and then medial epicondyle that is here. Then from this view, this is the posterior view of the femur. That's we have the head of the femur, the neck here still, the greater trochanter, lesser trochanter, and the intertrochanteric crest, we have it right here. Then below the lesser trochanter, we have a pectineal line that is here. Then here is actually the area of attachment for the gluteus muscle. This is what we call the gluteal tuberosity. It's right there. And then right here we have what we call this one. This is what we call the linea aspera of the femur. Then when you come down, we have the popliteal surface that is right here. Then we have the intercondylar fossa that is right inside here, and the intercondylar line that surrounds the fossa, just like that. And then we have the medial supracondylar line that is right here, and then the lateral supracondylar line that is right here. And then down here distally we have the lateral condyle that is on this side, and then the medial condyle is on this side. As we said, although the epicondyles are there, the medial and lateral, the condyles are these surfaces that are right there. And then if you look at this other view, that is how these same things appear. The head of the femur, the fovea capitis is right there. We said it's the point of attachment for ligamentum teres. Then we have the neck here, we have the greater trochanter, lesser trochanter. We have intertrochanteric crest right there. So let's look at other views to see details of the distal ends. Still here we're on the same things, the fovea capitis, the head, neck, greater trochanter, lesser trochanter, all right there. when you look at the femur distally, this is what you see. Here, this intercondylar fossa is clearly shown. Here, this is what we have. It's right here, and then intercondylar line surrounds it. That is the line that surrounds it, and then we have the medial condyle right here, lateral condyle there, and then we have the epicondyles here, the medial and lateral, they are there. Then we have the supracondylar lines. The lateral, we have it out there, and the medial here. This is what we call the popliteal surface. It's right there. And then we have on these other aspects, this is the anterior view. The medial side is right here, and the lateral side is also there. These are the condyles, lateral and medial here. Then behind the patella here is actually a surface called the patellar surface. These are the features we see on the other view. Then this is what we see on the x-ray. Distally, the femur appears like this. The patella is here, the condyles are here, down here. Then the epicondyles are also up here. The supracondylar lines are here. Of the supracondylar lines here and here. The condyles are here and here. Epicondyles are there. This is what we have. This is briefly what we have for today. In the other videos, we shall be looking at the other details. Thanks for watching. See you in the next video.